Welcome back to the American College of Surgeons Bulletin Brief from the Frontline Surgeons' Voices. It's with great pleasure today that I welcome two of my dear friends from the Board of Regents, Dr. Anton Sidawy, now the chair of the Board of Regents. Dr. Sidawy, for his day job, is the professor and Lewis B. Saltz Chair of the Department of Surgery at George Washington University in Washington, D.C., and Dr. Linda Phillips, the Vice Chair of the Board of Regents for 2021-2022. And Dr. Phillips is the Chief of the Division of Plastic Surgery and the Truman G. Blocker Distinguished Professor at the University of Texas Medical Branch at Galveston in Galveston, Texas. Welcome, Tony. Welcome, Linda.
Thank you. Thank you, Stephen.
And congratulations to both of you on your elections to these jobs. And when I mentioned, Tony, your day job, you're going to have two day jobs. Same for you, Linda. There's a lot of work to be done.
That's right. Yeah, but it's an exciting work, though, Steve. I know Linda and I were been chatting since this happened, and we're actually very excited about it. And we wanted to do a lot of things, and I'm sure we're not going to be able to do everything. But in addition to that, we also talked about continuing with what you and Scott started, your few projects that you added this last year and formalized. And so we wanted to continue with those because we feel it's important to do that. And actually, I've always believed that any organization like the college is bigger than any one of us. So I tend to look at continuing with projects that need to continue, not to every year a new chair and vice chair of Board of Regents come and then they decide to start their own programs and their own projects, and then another one comes and gets interrupted. So we thought that the three main projects that you guys formalized, because some of them started before, but you actually decided to pursue them in a formalized manner, namely DEI, which is most important, DEI and anti-racism, and specialty engagement. Those are, we believe, extremely important, and also communication, which you led, Stephen, in an excellent manner. So we wanted to continue with those communication. Obviously, it seems like you're going to continue to oversee that with the staff of the college. And anti-racism and DEI, Tim Eberlein committee, on which I serve, is going to continue with that as well. And this is a very important program for the college, and the college is putting together an infrastructure for it. So that committee plus the infrastructure that being put together by the college is going to take that to a higher level. And as you know, about the grants that were given this year regarding this same area are excellent grants, and we hope to learn quite a bit from those proposed projects. Those are the main two things, but also their specialty engagement, which we all now believe that's extremely important. And I'm really so glad that Linda, as the vice chair, really wanted to lead the efforts in that area. And that will give specialty engagement a high profile, continue to give it a high profile in the discussions of the Board of Regents. And Linda will obviously tell us a little bit about that area and how she thinks she's going to move it forward. But in addition to all that stuff, this is a pivotal year in the recent history of the American College of Surgeons. And it is pivotal because we will have a transition in the executive director position. The executive director of the college is like the CEO of any corporation. Dr. David Hoyt, obviously, has been the executive director for 20 years. And he carried the college, and now the college and its programs is actually completely different than when he started. He did a superb job at that. But now there's a transition to Dr. Patricia Turner, and we are going to use that opportunity with the Board of Regents to start thinking about how the executive and the board, which is management and governance, how to actually work more together to move the college forward. And also, we wanted to look a little bit strategically on the various programs of the college. So we're actually thinking about all these things, and Linda and I are putting together a plan how to approach all these issues.
Well, thanks very much for enlightening us on what you want to do, continuing forward with some of the projects that initiated last year and others that were continued through last year. And you invoked Linda's name when you spoke about specialty engagement, which seems very appropriate given Scott Levin's background in plastic surgery, as well as orthopedics, of course, and Linda's background in plastics. So maybe Dr. Phillips, you can tell us something about what specialty engagement means to you and what you'd like to do with it this year.
To me, it means that we need to do a better job of communicating the importance of the specialties to ACS as a whole, and also the importance of ACS to the specialties. So in your role in communication, I think that we see a great synergy for the specialties, because part of it is reminding them of how much the college does for all surgeons. And for me, it's keeping the specialties in the house of surgery, as Scott Levin has so often referred to it, and keeping our place at the table. I think it's critically important that we have numbers, and that those who are interventionalists, who are surgeons, stick together, basically. We've seen that is important with Medicare, Medicaid, and funding differentials, things like this. And so part of it is reminding people. Part of it is showing what programs the college has and what they do for the specialties. So my plan is to open lines of communication and to speak with the regents, governors, advisory councils from the different specialty disciplines of surgery, and include the young people, the RAS, and the young surgeons, so that we get an idea of what it is that engages them as well. Reminding them that we have not only numbers, but we have a war chest, a treasury that is far bigger than any other professional organization has. And with that, we can do much more. What we want to do really is bring the specialty organizations together and unite us. I'm planning to do this on a more individual basis of regents, governors, and advisory councils. There's also this new change in what's going to be required for maintenance of certification. That's going to impact all of us, again, because of size and economy of scale. The college is best positioned for that. As I'm going to be talking with the different disciplines of surgery, I'm also seeing myself as being able to coordinate some and share ideas among the different groups. I know that the college has already met with a number of the organizations, and I would like to participate and continue in that process. I see myself working with you a fair amount on communication to the specialties as we go forward this coming year.
Well, thank you. That's an interesting offer. And I'm just thinking as we're talking of some potentials for getting specialty messages out to all of the fellows, which could range in variety. So we'll have that discussion later on, but it's definitely intriguing about some opportunities we'd have to get specialists. Many of us have general surgery training. Not everybody has full general surgery. Many of us do, but as you get further from it, it's still nice to know what's going on in the other disciplines. So thanks for that offer. You also mentioned getting involved with the governors, with the advisory councils. Do you see any significant changes in those areas coming up? Any changes in the relationship of the regents, or things you'd like to see in terms of reporting, in terms of projects, advisory councils, governors, chapters, and the like?
I see that there's been significant effort for better communication, eliminating the isolation that each house had, whether it's regents, governors, advisory councils, local chapters. And I know that you made significant effort in that area. The year before, Scott Levin had done that, Jim Elsey. So there's a long track record of several years. I certainly don't want to be the one to break that. So I'm going to make that a major effort as well to communicate. And we all know that communication can't be overdone. And so I'm going to try to be there and bring the message in as many ways and as many places as I humanly can.
Great. Thanks very much. And I'm sure you're going to do a phenomenal job. I'm sorry I won't be in the room participating, but I know you're going to do a wonderful job. Dr. Sidawy, one question in terms of strategic priority and directions, if you could maybe show us your cards, as it were. Many years the regions have strategic retreats because there's a burning platform or a priority. And in different years, that's been different things. It's been, how are the regions structured? How does the college function? To what degree are we representing public versus patients? What do we do with education? As you've now begun your year as chair, and we've not had in-person meetings in 2 years, are you thinking in terms of a strategic priority with or without a strategic retreat?
Yeah, actually, we are really thinking, and we're going to try very hard to have the February board meeting in person. We actually talked about it today with Dr. Hoyt and Dr. Turner. Obviously, there's still some limitation in the city of Chicago, but we're waiting to see how we can manage actually to be in person. As you know, we have 6 positions that just turned over in the Board of Regents. These 6 new regions, I think it will be really good for us to be able to bring them in, engage them, work together with them in person. And that, I believe, will facilitate what we want to do. Now, I know what you were talking about from point of view, strategic retreats and strategic plannings. As you said, those were done regarding a burning platform. The conversation that I've been having with Dr. Turner, I talked with her, she is in favor of that, and also discussed it at the last, in my few comments that I made in the last Board of Regents meeting, and also discussed it with Dr. Hoyt. It is now an opportune time to start looking a little bit more strategically on different department programs and see if now with the new leadership with Dr. Turner, what to do with different programs. The college has unbelievable, excellent educational quality and otherwise programs. I mean, really, they are excellent, no question about it. In this process, the idea is to engage those departments and departments leadership and Dr. Turner down the line, and start thinking about what those programs are and what we feel as a leadership of the college is going to be important, what's coming down the pike in the next 5 years. And are there other things that we need to do to get our fellows ready for that, be it education or be it in advocacy or quality, all that kind of stuff. And as you know, for example, we talked quite a bit about our quality programs, which are superb, are next to none in surgery, as we know, in the United States, and some are abroad as well, like NSQIP. And the idea how to bring all these programs together, how to give them maybe a unified platform, makes it easier for hospital and easier for our fellows that work in those hospitals to actually manage the quality programs. We have many, and we have them now expanding into all specialties. Little by little, they're becoming a bit unwieldy for hospitals, and we heard that, and we've been talking about it. So how we can bring all that stuff together to be managed a little bit easier than they've been now being managed, how we can bring them so we don't have, for example, so many visits for different programs. Can we bring them all and have one longer visit and basically review all our program in a certain hospital? So stuff like that that we need to start thinking about and maybe start planning for it. And I think this process will help us to do that.
Fantastic. Sound like absolutely wonderful plans. Dr. Phillips, why don't I offer you the opportunity for any additional comments before we close?
I think we have an opportunity as well in our educational programs to reach out to the surgical specialties. Our strength, because we are the house of surgery, is in multidisciplinary activities and education. I believe we have an opportunity to build on that, and that would certainly increase specialty engagement. And that is something that is across the board in medicine in terms of interdisciplinary care of a patient being more cutting edge and better for the patient. And so that's something that I would also like to open discussion with the new chair of the program committee, Dr. Fabrizio Michelazzi, and Dr. Sachdeva from the college staff to see what opportunities there are and how we can go forward.
Great. Well, I appreciate both of your insights today. I congratulate you again, and I look forward to an absolutely outstanding year. I'm happy to facilitate any way I can, but you are going to be having a wonderful year. I hope you do get people back together in February. And you're right, with 6 new regents, it really is important for people to meet each other and spend some time. And in fact, the regents who started last year have never been to an in-person meeting. The 2019 people who started in 2019 got one meeting in February, people who only one, right? And the people who started in October 2020 got none. So,
but we're keeping our fingers crossed, Dr. Wexner. And if we can achieve that, I think it will be really great, because we need that camaraderie. We need to be talking to each other, and we need to come together as a group, not only on a screen, but also in person. So hopefully we can make it happen. I'll be a happy man if that actually does happen.
Yeah.
And we'll go from there. We're going to try.
Wish you success with it. I know it's going to be a fabulous year. So thanks again for your dedication to the college for this, all of the years, but in particular this coming year with your leadership of the regents, and look forward to seeing both of you in person maybe next October in San Diego.
Well, thank you very much. Looking forward to it.
Thank you very much. Thanks for this opportunity. Great to see you all.
Indeed.